Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. The numbers keep piling up in San Diego and across the country. Since February, more than 217,000 Americans have died from COVID-19. And this weekend, we're likely to reach the 8 millionth case. More than 63,000 of those cases are from San Diego and Imperial counties, with nearly 1,200 deaths. San Diego is in a holding pattern in the red reopening tier, and the lack of progress is wearing on local leaders. More now from KPBS health reporter Taryn Mento.
No new restrictions for San Diego County. The region's rate of new coronavirus cases keeps it yet again in the state's second most restrictive phase of reopening. Supervisor Nathan Fletcher says it's not all good news.
But the bad news is it's not getting better.
County businesses have been stuck running at limited capacity with few signs that'll change soon. The Board of Supervisors recently approved more funds for struggling companies and nonprofits, but the region's adjusted COVID case rate is just barely below a level that would trigger closures.
But we are living on the edge and the precipice of going into that higher tier every single week.
He says improving that comes down to the public following the county's public health orders.
While we know the overwhelming majority of San Diegans are doing everything right, they've got in a routine about wearing their mask, they're avoiding large indoor settings, they're physically distancing people they don't live with, they're washing their hands. The reality is we'd like to see our case counts descending.
But at the same time, the state recently okayed small outdoor gatherings, and interactions during upcoming trick-or-treating are a concern. Plus, more school districts are planning to reopen. And Supervisor Greg Cox says flu season could put added pressure on hospitals.
That will be critical this year, more so than ever, to avoid a double whammy from the flu and COVID cases.
He encouraged San Diegans to get their flu vaccines. Free flu shots are available, and details can be found at 211 San Diego. Taryn Mento, KPBS News.
More than a dozen factors go into deciding local public health restrictions, and one of those is the number of public outbreaks. Coming up a bit later, Taryn Mento will go in depth on measuring this key statistic and how it's changing as we learn more about the pandemic. UC San Diego has put its COVID-19 vaccine trial in National City on hold. KPBS reporter Jacob Ayers says the local trial is on pause because one participant from the global study developed an unexplained illness.
The trial was supposed to begin in National City's Toyon Park, but vaccine maker Johnson & Johnson put the study on hold for the moment.
It simply means that we are waiting for safety regulators to review the event that occurred somewhere, don't know where, for some participant to see if the event is serious enough to wait and do a more thorough evaluation or reactivate the trial and let us start enrolling.
Johnson & Johnson isn't disclosing the nature of the illness that struck a participant in the global study. A spokesperson for the company said they don't yet know whether that person received their experimental vaccine or a placebo shot. Dr. Little says this sort of thing isn't unusual.
Pauses occur all the time during large phase 3 clinical trials. So this is a trial of 60,000 individuals. So it wouldn't be unusual for another pause to occur.
The pause is at least the second such hold to occur among several COVID-19 vaccines that have reached large-scale final tests in the U.S. National City was chosen as the location for the local vaccine trial as it has been one of the hardest-hit neighborhoods in San Diego County.
I have submitted my name and my application for this COVID-19 trial because I believe it's part and parcel to being a good leader.
Once cleared to restart their trial, Johnson & Johnson will recruit up to 60,000 participants around the world to assess their COVID-19 vaccine over the next 2 years. Jacob Ayers, KPBS News.
COVID-19 isn't just a threat to our physical health. Its effects are also taking a toll on our mental health and causing an uptick in related issues like addiction. Max Rowland Nadler shows us a group in City Heights that is meeting with people in crisis.
Before the COVID-19 pandemic, almost everyone seeking addiction services at La Maestra Community Health Center came here along Fairmont Avenue. But since the pandemic necessitated social distancing, almost all of those services have gone online.
We would help people coming in for assessments, follow-ups.
Dr. Mario Salguero practices psychiatry and addiction medicine at La Maestra Community Health Centers. He says things used to be different.
Telehealth or non-in-person services would be 1% or less. It was rare.
Most of the patients Dr. Salguero sees are from the surrounding community, and they had been receiving in-person treatments either in a group or one-on-one regularly.
At the core of substance use disorder issues is isolation. You may be around people, you may be even in a session with a therapist, a provider in person, but not being able to connect is an essential problem there.
But the COVID-19 pandemic, which has increased both social isolation and economic suffering for people, has only worsened the country's mental health and substance abuse crisis.
Anxiety issues have tripled. Depression has more than doubled.
So Dr. Salguero and the rest of the addiction team at La Maestra, which sees hundreds of patients, shifted over 70% of their patients to telehealth.
People, knew we were there. We were able to reach out to them. For our sakes as well, staff, we care for our patients. We care for the people we help out. And also it was a huge concern. How can we continue to help all these people out? Sometimes we need to see people weekly to make sure they're doing well.
Using a system called NextGen, patients are able to use a web browser to chat with their doctors. And if they lack access to reliable internet or a smartphone, they can come into a room at the clinic on Fairmount Street and speak to their doctor safely through an iPad. Dr. Salguero says that even after the end of the pandemic, he wants to make sure the telehealth option sticks around, especially for those who face barriers to traveling to the clinic.
Missing appointments has, dropped, which is great because we've been able to access so many more people, not only our usual, say, people in the area, but even people in areas that are farther away from us. So being able to reach more people has been, a good surprise.
Dr. Salguero says that for anyone in San Diego dealing with depression, anxiety, or addiction issues, help is out there, and he encourages people to seek it out through the La Maestra website. Max Rivlin-Adler, KPBS News.
COVID-19 is casting a big shadow over so many choices Americans will make in just a couple of weeks. Early voting in the general election is underway, and already nearly 200,000 San Diegans have cast a ballot, according to the local registrar. You can review all of the races and ballot measures in your area with the KPBS Voter Guide. Just click on the Voter Guide link at kpbs.org. Those running for the San Diego Unified School Board will step into a much bigger challenge than those who were elected just a couple of years ago. KPBS education reporter Joe Hong tells us about the candidates and how the pandemic is shaping their campaigns.
Being a school board member is a difficult job even in the best of times. The responsibilities include managing a Byzantine budget, listening to disgruntled parents, and making decisions that have far-reaching consequences for the lives of students. Now we have a global pandemic that has upended nearly every aspect of public education and a reckoning over racial justice that has forced educators to address the uncomfortable question of who gets left behind in our classrooms. It's against this backdrop that 6 candidates are vying for 3 seats on the San Diego Unified School Board, which serves 100,000 students. In Subdistrict A, which covers Claremont, Mira Mesa, and University City, 2 candidates are competing to replace current board president John Lee Evans, who isn't seeking re-election. Both of the candidates agreed the district needs to rely on public health experts rather than rushing to reopening schools. Sabrina Bazo is a public health educator and a longtime parent volunteer in the district. During the past decade, she served for 6 years as the Mira Mesa High School Foundation president. She hopes to expand a peer tutoring program that she helped start at Mira Mesa High.
Now we're up to about over 30 tutors, I think, and we've probably reached about 50 families or so, and we're continuing that program. So it's a good example of something that we could replicate in other parts of the district that's totally free of charge. We're trying to keep it volunteer, and we're trying to really identify those students that need those resources the most.
Bazo's opponent is Crystal Troll, a professor of nonprofit management. She said her experience consulting for nonprofits makes her uniquely qualified to bring accountability and transparency to the district. She said she's been disappointed by the lack of open communication between the district and parents.
They've just been making a lot of decisions and having discussions behind closed doors. They tell us little things here and there, but I think that the parent engagement piece has really suffered in terms of communicating.
In Subdistrict E, which covers neighborhoods in southeast San Diego, Luana Richmond is challenging incumbent Sharon Whitehurst Payne. This subdistrict serves a disproportionate number of low-income students and students of color. Richmond has a doctorate in educational leadership and currently works as an organizational development manager at UC San Diego. She said her experience in the foster care system and as a teen mom has given her a first-hand understanding of the challenges facing the district's most vulnerable students.
In times like this, when you have enormous disruption in any type of system, it's an opportunity for exponential growth and progress because you learn things that you never would have found out in such a condensed and short period of time, because you don't have any choice but to learn unless you choose not to.
Whitehurst Payne, who's trying for a second term, says as a board member she's made sure the district acted swiftly to distribute food and devices when schools first shut down.
We wanted to get learning devices out to all children because we know our schools and we know that in some communities we have a digital divide.
Apart from COVID relief efforts, Whitehurst Payne said her primary achievement has been improving training for special education teachers.
I have made a difference on this board. I've been able to identify some of the critical issues that would impact District E, African Americans, Latinos, and just across the board.
Richard Barrera is running for re-election to represent Subdistrict D, which serves downtown San Diego as well as the neighborhoods of North Park, Barrio Logan, and City Heights. A labor rights and community advocate, he's currently the board vice president and has served since 2008, running unopposed in both 2012 and 2016. He said the work he's done helped prepare the district for COVID-19.
Our district has become a much stronger district with much better outcomes for students, much more equitable outcomes for students. And I think we're much clearer about what we need to do going forward.
Barrera is challenged by Miramar College professor and longtime school counselor Camille Harris, who ran against him in the primary as a write-in candidate. She said the COVID-19 crisis in education gives leaders an opportunity to steer the district in a new direction.
These kiddos are suffering. Parents are suffering. Parents who have to work from home and trying. I have, people that I know who are two-parent families, and they have to teach their students and monitor them, and they're in charge of their education.
Joe Hong, KPBS News.
Those running for San Diego City Council will also inherit the COVID-19 challenge. Claire Tregesser shows us the candidates for District 7, one of just 2 seats that feature both a Democrat and a Republican.
Noli Zosa, a Republican, is a co-founder of the restaurant chain Dirty Birds. His business experience informs his views on how the county responded to the COVID pandemic. He was frustrated as a restaurant owner that when the pandemic first hit, the county allowed big box stores such as Walmart to stay open, but forced businesses like his to close.
We could have operated those same guidelines, and we are operating now. But during those critical 2-3 months where we were shut down completely, a lot of small businesses folded, unfortunately, permanently.
Zosa's Democratic opponent, Raul Campillo, sees things quite differently. The deputy city attorney says the county's response to COVID has not been strict enough.
When new policies come in place, regardless of what area of life they are, if they aren't enforced early, the public is going to not take it seriously. The county should have made sure that they were going to cite people who were violating the health orders early on. And I'm not talking drastic, punitive measures, simply citations where people knew I am going to be paying a small fine if I violate this.
The ongoing pandemic will likely force the city council to make further budget cuts in the 2021 fiscal year. Campillo says if elected, he would want to cut spending by eliminating outside contractors.
We shouldn't be sending to outside firms and instead should be bringing in an engineer or surveyor to work for the city and be able to plan projects in-house.
Zosa would cut.
The money that San Diego and the city is spending on protected bike lanes, that San Diego is spending $279 million on, which that money should be going to fixing our streets and our roads.
The outcome of the race could impact the balance of power on the city council. If Campillo replaces the Republican Scott Sherman, it would mean Democrats pick up an additional seat. Claire Tregesser, KPBS News.
And our local tourism industry is still struggling to rebound from the pandemic. Eric Anderson spoke recently with Julie Coker, the head of the San Diego Tourism Authority, about the impact.
To date, just the conventions that the San Diego Tourism Authority booked, we've lost 47 conventions since March of this year. That's close to $1.2 billion in economic impact over 700,000 room nights that our hotels would have consumed. And again, that's just a piece of the pie. We've also lost groups that our hotels are unable to hold at this time, any meeting, convention, or trade show. So in terms of the convention market, the meetings market right now, it's really devastated. As you know, we still don't have direction from the state as to when we'll be able to hold controlled gatherings. So right now, we don't have any gatherings at the convention center through the end of this calendar year. And we're seeing some slippage already in January and February, which is concerning.
Things are really, really bad in March. A lot of businesses completely closed, hospitality industry, restaurants. How far back have we come?
So we're fortunate that as of June, hotels were open for leisure stays. And we saw a very strong demand, especially Thursday, Friday, Saturday, as you can imagine, weekend stays. That has continued through the summer months. And then since Labor Day, we've seen obviously a sharp decline on our weekday business. And that's always been a challenge for us because San Diego has been fortunate to have a number of conventions that were booked throughout the summer months that cover Sunday through Thursday, as well as that business traveler. So we've lost the convention traveler. We've also lost the business traveler, which has impacted the weekdays. So right now we're running about 50% occupancy, which is significantly less than we traditionally do. Traditionally right now we would be sold out every weekend in the fall, and then we would be running about 80-85% occupancy in our hotels weekday. So this is a prime convention business traveler season right now that we're not being able to take advantage of. So we're doing better than most cities, but we still are significantly lower than where we should be.
How does not having all of the region's visitor attractions open and available to the extent that they were before COVID, how does that impact the decision to come to San Diego?
So the good thing about San Diego is that we have some natural resources here that others don't. We've got miles and miles of beautiful beaches. We've got a welcoming community that's diverse and inclusive. And then, of course, we have our great cultural attractions, Balboa Park, USS Midway, the zoo, the safari, SeaWorld. So that has really helped. Certainly, we would love to have all of our attractions being able to open. Legoland, that certainly adds to the product that we can offer visitors. But right now, what we have is definitely a driver to the destination. Really, what we're missing is that business and convention traveler.
What are you doing to help bring some of that business back?
Certainly, as we know as business professionals, as long as we have Wi-Fi, we can work anywhere and we can be efficient anywhere. So why not do it in a destination that has great outdoors, an awesome hospitality community, and a lot to offer. So we have really reached the traveler where they are. If you're local, stay vacation here. If you are in a regional drive audience, we have something for you. But then more importantly, if you are looking to travel down the road, November, December, January, we would want that to be San Diego. And so our messages are being communicated in that way.
Free parking is officially over in the city of San Diego. Following a 2-week warning period, the city resumed parking enforcement. Meters and some parking zones were on holiday rules since March, but that took a bite out of the city revenue, and as more people resume regular business, the change is being made. And it's becoming clear that making up what's been lost financially might take years. A new regional report shows our area took a hit of more than $12 billion, and we're not out of the woods yet. KPBS reporter John Carroll has details on the parts of our economy that are hurting the most.
The Sandag report looks at the effect of the pandemic on our economy for 6 months, from when the statewide stay-at-home order was issued in mid-March to the middle of last month. The $12 billion loss has primarily affected tourism, retail, and education. That translates to 80% of the jobs lost.
There's probably around 176,000 jobs that are lost or can be directly tied to losses due to the COVID. And about 140,000 of those are in the 3 industries that I mentioned previously.
It's not all doom and gloom. There has been fairly robust recovery in some industries.
In the industries that are primarily white collar, when you take a look at things like the innovation sector, you look at finance, insurance, and real estate, pretty much those jobs have come back and people are working remotely.
It's the people who can least afford it who have been hit the hardest. Workers who earn less than $27,000 a year.
So that's pretty much minimum wage employment. We see that the employment levels are still down by 23%.
Tourism is starting to show a bit of recovery. Major says mainly from people driving down from LA and Orange counties. It's the business travel segment that Major says might never go back to where it was because most business conferences are now being held online.
Will a business really send its people across the nation, pay for the airfare, pay for the hotel, the price of entrance into the convention?
Major says we'd be in even worse shape if it weren't for money from the first stimulus bill. He says a second one is critical to keep San Diego from falling into a financial abyss. Whether and when that will come is, at this point, unnervingly uncertain. John Carroll, KPBS News.
Our economic recovery is directly linked to our public health. The sooner case numbers and other metrics improve, the sooner we can fully reopen. In our ongoing series about COVID-19 data, KPBS health reporter Taryn Mento says the significance of counting outbreaks has waned.
The University Christian Church bells are a familiar sound in San Diego's Hillcrest neighborhood. But there used to be another melody ringing from the sanctuary. The San Diego Gay Men's Chorus rehearsed in the space for its upcoming Broadway concert series. But the group went quiet in March. Executive Director Jeff Heine says they canceled rehearsals as a precaution.
There was still a lot of unknown. There was an unknown quantity to this virus back then.
The show was delayed until next year.
But we wanted to be safe.
The last rehearsal was 10 days before Governor Gavin Newsom ordered all Californians to stay home.
That directive goes into force and effect this evening.
But COVID was already in the door. 4 chorus members would later test positive and become one of the region's first community outbreaks.
It hit me hard because I was like, oh, you really hope it doesn't happen.
There have been hundreds of outbreaks in San Diego County since then, and officials track those clusters to measure how much COVID is spreading. Outbreaks are one of 13 triggers the county uses to determine public health restrictions. But a KPBS review of the triggers found it's a complicated and evolving system. For example, there should be no more than 6 community outbreaks in a week, but we've exceeded that number for months. The San Diego Unified School District initially said classrooms wouldn't reopen until we met that goal, but both county and school officials are reevaluating this metric. For the Gay Men's Chorus, news of COVID illnesses circulated just days after practice was canceled.
A singer would post something on Facebook saying that they were home sick, not feeling well.
Heine eventually contacted the health department. He said he was told the info helped them link the cases together.
If they've been told to stay home or if they have tested positive, we have their names already. You're just helping us to connect the dots.
County health officials connect a lot of these dots. At one point, staff confirmed 40 community outbreaks in a week. There are fewer now, but still more than the threshold. And the county's Dr. Wilma Wooten is giving the metric a second look.
Obviously, we knew as things would open up that we would have more cases. So we have asked 2 entities to look at modeling to determine going forward if that number should change or remain the same.
That was a month ago. County doctors wouldn't give an interview for this story, but a spokeswoman says they're still reviewing the threshold. In the meantime, parents have pushed San Diego Unified for a clear reopening plan.
It's not acceptable.
But other parents are pushing to reopen only when experts say it's safe. UC San Diego's Dr. Howard Terras is advising the district on when that is. He says he acknowledged early on plans could change. The school board just okayed sending a small percentage of students back to limited in-person learning next week.
It doesn't worry me to open schools more than we are now in the San Diego Unified School District, if only community outbreaks, especially the type of community outbreaks that we're seeing, is still not quite yet up to par.
Meanwhile, all 4 San Diego Gay Men's Chorus members have recovered, including one who was hospitalized. Heine says he's not sure where or how COVID was transmitted, but he thinks at least one singer contracted it from his job in the medical field.
We believe that's where he probably caught it from, and not necessarily with the chorus at all.
A county spokeswoman said linking an outbreak to an organization or a location doesn't mean that's where transmission occurred. But the chorus rehearsal space is still empty.
God, I miss it. I really miss it.
The chorus did briefly reconnect in June at Balboa Park. They recorded a socially distanced video to them singing Somewhere Over the Rainbow. Passers-by recognize them. Heine says after canceling 2 seasons of concerts and profits, the experience lifted the chorus's spirits.
And I think for the people who gathered too. I mean, it kind of gets you wondering, well, what would stop us from just going out into the park and just singing Christmas carols in December or wandering around or things like that.
Their return to Broadway show is scheduled for April, but it's unclear what the data will allow then. Right now, live theater is not part of any phase of the governor's reopening plan. Taryn Mento, KPBS News.
And that's all for this special edition of KPBS News. For all of us here at KPBS, I'm Maya Trabulsi. Thank you for joining us, and stay safe.